Hey guys, this is Dr. Omkar, a physiotherapist from Mumbai, and welcome to another episode of PhysioFeel. Feel the physiotherapy. Today, I will be telling you what are the functional limitations that a patient with frozen shoulder syndrome shows. What are the common symptoms that they complain, and how a physiotherapist diagnoses frozen shoulder. But before that, let's talk about the common impairments. A patient with frozen shoulder syndrome may complain of pain at night and disturbed sleep during acute stage, pain on the movement and often at the rest during acute stage, decreased joint ranges, especially external rotation and abduction, with some limitation of internal rotation and flexion, decreased arm swing during walking, and muscle weakness and pain. If you are suffering from any of those symptoms, I recommend you to visit your nearest physiotherapist so that you can prevent further complications and stop your body suffering. Now let's talk about the functional limitations and inabilities. Patient may feel difficulty to reach overhead, behind head, out to side and behind back. Patients may feel difficulty in grooming and dressing, such as wearing jackets or coats, reaching hands into back pocket, fastening undergarments behind the back, and self-grooming activities such as combing your hair, brushing teeth, washing face. You can regain your all lost functional activities if you know when to visit physiotherapist. A provisional diagnosis is made after an initial assessment. A physiotherapist uses two special tests to rule out signs of frozen shoulder syndrome, along with some radiological investigations like MRI if needed. Now let's see the special tests. First is the adhesive capsulitis external rotation test.
Patient seated or standing. Patient or therapist externally rotates patient's affected arm. Positive sign shows decreased range of motion, painful leathery feel before normal shoulder external rotation.
And second is adhesive capsulitis abduction test.
Patient is seated or standing. Therapist stands behind the patient and slowly abducts patient's arm. Positive sign shows painful and leathery feel before 90 degrees of abduction.
Today, I just discussed symptoms of frozen shoulder, functional inabilities that a patient shows with frozen shoulder syndrome, and how a physiotherapist diagnoses frozen shoulder with the help of special tests. In my next episode, I will be telling you treatment for frozen shoulder. So guys, stay tuned. For latest updates, please subscribe to the channel. And if you feel your friends and family should know more about physiotherapy, then do share this video because it's all about PhysioFeel. Before we end, I just want to tell you one thing guys. Ask for a stronger shoulder rather than a lighter burden. Correct? See you in the next episode. Till then, goodbye. Stay healthy.